Welcome to Unhinged and On Call. I'm Dr. Chelsea, your resident veterinarian.
And I'm Trish, a registered vet tech who's seen it all. Each week, we're pulling back the curtain on the wild world of veterinary medicine, from late night emergencies to barnyard drama.
No filters, no fluff, just real stories, real laughs, and maybe a little emotional damage. Thanks for letting us share the madness with you.
Hi, everyone. Welcome to Unhinged and On Call. We had the best time today talking with our guest, who is Mark Romanowski. He's technically certified in each certification. So if you're not familiar, technicians are certified by state. So there's LVT, RVT, and CVT. So a licensed vet tech, a registered vet tech, and a certified vet tech, which we've all been working towards confusing. A universal term. Yes. But when you move from state to state, you have to recertify in that state for their credentials. So Mark is a complete badass and has done that in multiple states. But he's currently in Brooklyn, New York. So he is an LVT out there, but the most incredible background in zoo medicine.
So impressive and so smart. He's just like
highly intelligent.
Which is what anybody in anesthesia, that's kind of his specialty is surgery and anesthesia. Anybody in that field is incredible, like wicked smart. He's just like so fun and personable as well. So his stories are so good, you guys. You gotta, it's a long one, but you gotta listen to all of it because it's really cool.
So fascinating. We talked about we need a part 2 because we had so much fun and we had so many questions because Zoom Med is just so freaking interesting. So, so stay tuned and don't forget to like and subscribe to our channel too, guys. We would love to have you follow along. So thanks so much.
Thanks, guys. This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for your pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
Hi, everybody. Thanks for joining us Unhinged and On Call. We're really excited to have a phenomenal guest today, our very good friend, Mark Romanowski. He is an LVT and he is out of New York. So I think actually our first New York person. I think I'm really excited. So so thanks for joining us. And do you want to give everybody just a little background of how you got into vet med and kind of your path through the way?
Sure. So it's been, oh my gosh, like almost 14 years now, which feels like I never thought I'd make it that far. But I started, got my associates. I was one of those kind of like troubled 20s. You know, I partied, you know, I didn't know what I wanted to do with my life. And when things kind of hit like a tipping point, I thought about what I liked a lot as a kid, which was like animals. Like you could read through my journals from like 2nd and 3rd grade and it's like, I want to be a vet or I want to be a zoo vet. Like all this stuff. And I was like, I don't think I want to do the route of vet school where like, you know, years of school, like I kind of wanted to like get into it quicker. So I went the vet tech route, which was, I think, perfect for me because I like being hands-on and, you know, I don't want to do the other things that vets have to do. So I went to school, got my associates, started out in GP at a Banfield, did that for like a year and a half until I got certified in Arizona, which is where I started, and immediately was like, what's the next thing? Where can I go next? And so I went to specialty anesthesia and surgery at a multi-specialty practice, where I was like, the first day in surgery, I was like, okay, I'm going to do my VTS. When do I start? And like, it was that level of like, I was so into it. I was like, oh, you have to wait 3 years to get my VTS. Like, can I just do it now? Like there was,
just have it.
It didn't make sense to me, but like, now I know like why we take so long to get some of these things. And so I did specialty surgery and anesthesia for about 4 years. And it was things like pacemakers, like full unzippings, like a dog that like ran into a stick.
That is intense.
It was crazy. And at like 3 a.m, you know, call in and there's a dog with, I remember the craziest one was a dog came in. It was like a border collie just limping to the owner. Like he called him in from the field. He was running around out there and he was just limping. he was like, oh, I'll just let him rest. Maybe he went too hard. And he started having trouble breathing at home. And so they brought him into the ER and they felt something in his thoracic inlet. He ended up having a stick that had punctured through his thoracic inlet all the way. It's like this long.
My goodness.
Punctured his pericardium, one of his lungs, his diaphragm, a liver lobe, his spleen, missed his bladder, hit part of his stomach, and then just rested in there. And all he presented with was
all he was doing was limping,
and then was like having some difficult, like a little more efforted breathing later on in the day. So the owner brought him in thinking it was like, oh, he pulled something, and so we unzipped that dog at like 3 a.m, chest open and abdomen open at the same time. And like, so that set the tone for me. And then the next morning, of course, it was like, it's time to play. Like the next morning when I came in, it was like, I'm ready to go. And so that kind of set the tone for like what I can handle, I think, in an OR. Like everything is more cool to me now than it is like scary. When something comes in, I'm like,
let's fix it.
Let's what are we doing? And so I got really I was going for my VTS then, and then one of our cardiologists would go to the Phoenix Zoo and do like pro bono ultrasounds for them, and they would take us along as his like assistants. We basically pushed the ultrasound cart and to go. But like so I went one time and I was like, I watched them. We did a kinkajou, a golden lion tamarin, and some other mammal. But I was like, oh my gosh, the tech. They have techs here. That's so cool. Like, how do you get here?
Yeah.
And I was talking to the tech and I said, can I come back? Like, I don't want to leave. Like, this is so cool. And she had me start volunteering. So I volunteered there on my weekends. And eventually they had a full-time shift open, a full-time position open. So I applied and I was like hooked on zoo. Like, it was my personality from then until the last like 2 years, and I wanted to learn everything I could. And I think my anesthesia knowledge really was enticing to them because everything is immobilized in the zoo for full exams. I mean, we're doing a lot of training. We do a lot of training now, but to do that real good physical where you're like looking at their teeth in detail, you need to do anesthesia. And so they liked that I could kind of come in and be like, oh cool, what are we doing today? Not like, oh my gosh, a lion.
Scared.
A lion.
It's all kind of the same. Like a lion is like a large Great Dane, like vitals wise. We use metatomidine and ketamine. Like we're using the same drugs, just in larger volumes and higher concentrations. So I worked at the Phoenix Zoo for a total of 4 years, 3 as a volunteer and 1 as like a full-time employee. And I had me and my partner at the time had separated, and I was like, perfect, my chance to get out of Arizona. So I went to the Oklahoma City Zoo for 3 years, and that's where I did the bulk of my like hardcore stuff. So I published 2 papers while I was working there. One was about stereotactic radiation in a jaguar that had a soft tissue sarcoma from a vaccine. And so presented that, and then at the AZBT conference, and then the next year we did laparoscopic hernia repairs on 2 gorillas. One was a 34-year-old female and one was a 6-month-old male, both using the same protocols. So it was a comparison paper because the infant exhibited a lot of like, when you insufflate bellies, it affects pressures and all that kind of stuff. And he was not as smooth as the adult. So I did like a comparison paper because we used neuromuscular blocking agents for the first time that was reported in gorillas. And so it was really cool to be able to like not only learn about those blocks and how they're used in humans, but how similar a gorilla surgery is to humans. And
interesting.
It was so cool. And like I have this picture of me like holding the baby and he's like reaching up, touching my beard, and I was like, this is like
framed on your wall in your home.
It is. And I have his little footprint too, so it's like the cutest. And so whenever I was like, when I do like my Hinge profiles and stuff like for dating, I'd make sure that one was on there.
I would be insufferable. I'd be like, look at this is everybody me with my gorilla.
I'm like, that was me like going out instead of being like, oh, what's your favorite music? I'd ask someone like, do you want to see what it looks like intubating a lion? And they're like, what? And I'm like, because your arm is like in up to your shoulder, like
oh my gosh.
And so I eventually got like the state of Oklahoma was not going to be my forever home just because it is Oklahoma and it has everything outside the zoo The zoo was amazing.
Yeah.
It was everything outside the zoo. So I went to the Henry Violet Zoo in Madison, Wisconsin, where it was me and one other tech as their full time, and then we used the University of Wisconsin as like our vet services. So they'd come in twice a week and do like the veterinarian only things, which really led me into being such a huge advocate for my patients, because I was there so much, seeing things that maybe the vets weren't. It really pushed me to be an advocate for the keepers as well, for their concerns, for their patients, for their animals. And that's where I met you two, because we had a camel who was well past the life expectancy. And I'm just gonna ramble now. If that's like, I feel like I'm good. Okay.
I'm like so interested.
Yeah. So
record, you're our first like zoo guest. So this is so interesting. It's so
incredible.
Cool.
To wrap up my background, I guess I left zoo medicine after I wasn't seeing eye to eye with some of the people in leadership positions, which led to a lot of intense moments to where I felt that for my mental health, leaving that situation would be the best. So that brought me to New York City, where I've since been trying to find my place back amongst normal veterinary people, or our version of normal. And I'm like,
that's so hard.
No one just gets what we did in zoo, whereas someone in a cardio practice, they're not going to be understood by
like, do you feel like you might thrive with horses?
See, well, that's the thing. I have worked on all types of horses.
I know.
Just not true horses. Well, I did.
Day, but not horses.
So at Phoenix, we had 34 horses that were part of like a hands meaning like their height. They call horses.
Oh yeah.
They called it like the Helping Hands program, but it was all horses. So like anywhere from 0 to like 2, there was a special class for them where they basically just like pet the age draft horses that were like, their backs are sunk. They're not doing any work other than standing there. So all the way up to riding, like for adults. And so I did a lot of like, we had some colics, we had a corneal ulcer where we did a subpalpebral lavage line. We like braided it through their hair. So like being able to take that and transfer it over to an animal like a zebra or a pseudo ruminant like a camel. I would say like anyone that has equine experience would thrive in a zoo, just because of the sheer amount of animals with similar gastric systems and feet. So now I'm in New York, and I'm trying to, I'm going back into anesthesia and surgery, I think is where I'm going to end up, which will be great. But so at the zoo, I originally reached out to you two because we had a camel who was 32, I believe. He was well past his life expectancy, and he had end stage osteoarthritis, like in all his joints. You could hear him walk. When he walked, it was like 10 seconds per step, very labored. And we were on like refractory doses of bute, tramadol, gabapentin. He was on Cosequin, and then we were like, he was perfect mentally, and so we were like, how can we get him some more time so at least the keepers can make his last day not his worst day. And we reached out to VetCS, who consulted with us on like, I think it was like the strongest isolate you had made at that point, because you're like, if we go higher than this, it's just going to be crystals.
It was basically sludge.
So we were like, we could do that.
But we treated him like a horse basically, or a cow, and his dosing, and we did like a stage dosing, and I have the chart still where you could see his shifting times when he was on his increasing doses. Like they dropped from like 15 minutes to 5 minutes. Like he was getting from place to place a lot faster, which was all the evidence I need to show that, hey, this is something's working about this thing we're adding. Because 1 week we ran out of his med for like 2 days, and his shifting times dropped back down immediately. And then when we got the refill, it was like right back up. But by that point, even the CBD wasn't helping. And so we did, end up euthanizing him. But it was that he got such a good last month of without feeling the worst he's ever felt. And so it's really, like I was saying, that made me a big advocate for my patients, because I think with CBD and now lots of other modalities, but there's that, well, we don't have any papers on it, or you'd bring it up and it would be, well, no one's, and it's like, well, they have, we're just not asking the right people, you know, and looking in the right places. And so I've since, you know, told all my zoo colleagues, like, get on the CBD train, and a lot of them have, like, really have. And it's so great to see that turning into less of a stigma and more of a another nutraceutical that we can try.
I love it.
But
did you ever think you'd do cannabis in a camel?
No, especially in Wisconsin, wild, right? Which is like,
Wisconsin. We were so just ecstatic to do that with you.
That was
like
so
it
fun.
was, it was such a fun project for us too, because it was new. Obviously,
it was new
like
back,
something
like
brand
early.
new.
Yeah, I don't think there's like outside of alpacas. Are alpacas pseudoruminants? Like, I feel like
they're actual. Or no, they have they're monogastric, actually.
Monogastric. Okay, so like a camel, I think, is unique in its own, that there isn't anywhere we can test this stuff unless you go to like a private ranch, you know, that has them. And so the only thing I wish is that we had collected blood to get like serum levels or, you know, that kind of thing. But the anecdotal is enough for me to,
it's still strong
to warrant it. So, cool. But that was there, and I was telling Trish last night, like two of the craziest stories I had, which were related to like hoof stock. We had these bison, and I don't know, in Colorado, I'm sure there's bison everywhere. Vets are probably more likely to work with a bison.
Just herded some bison on a horseback.
Last week. You work young bison because they're a little bit more fractious than cattle. So like for cow horses, it's easier to work bison.
So can you
but small ones.
But so you just like herd them.
You're just herding them, like moving them and stuff like that. Yeah.
So they're used to, like, so that's the thing with this young female. She was like 8. She was, you know, pure energy at her age, and we had like a 25-year-old male who was like the exact opposite. His name was Beefcake. And we were darting him one day for his vaccines, and we would do like a double barrel dart or a double dart in one barrel, like a CO2 pistol. And so we moved everyone off exhibit except for him, so that if he like chose to just run, he wouldn't have any sort of competition. And so we darted him. He just stood there and ate his grain, like, you know, he didn't care. But so we were like, had that adrenaline rush, you know, where you're like, and then nothing happens, and you got to go like run around the building like twice to like get it out. But so like we're like walking away, and we hear over the radio the keeper's like, hey, can vet team come back to bison? One of their horns fell off. And I was like, we like looked at each other, like their horn fell off, like it fell off.
What?
And apparently
those things are hard to remove.
So like they let the female out to like, because everything was done, and she went crazy. Like she got the zoomies and like knocked it on something, and she avulsed her horn sheath. And so they go back to her, and she comes walking up like, oh, you got snacks? And she's got a bloody stump over here and like a full horn.
So much.
But her fur, like,
it like absorbed it?
Yeah,
like,
so it wasn't like bleeding. So we just were doing some like topical like Vetricin spray on it until it eventually just hardened over, like someone coated it with mud.
Wow.
And she had a little stump there. But so that was just like the thing of like where you think the day is going to be easy, and then someone does something. It's not an illness. It's not like she wasn't even the one getting darted.
It wasn't
like,
even it wasn't even her.
It's not even like, about you, girl.
What is your problem?
Steal the show.
But so that was my first one, and like I never had
first one?
Like horn bullshit where I'm like, I didn't even know that could happen. Like I thought it was like glued on there real good.
Me
like,
too.
Nope, it
just hard to get.
It was like someone had just pulled it off in one piece. And, like it was crazy.
She must have like. I would think you'd have to get it like lodged, so, like stuck, and then she tried to pull. Or like, I don't know. That's
so unless she did that,
find a way.
So unless she was sparring crazily the night before and it was already loose, or I don't know. But I feel like they're meant to not just come off easy.
Fall
you know,
off.
She would have to be like struggling with something for a while. So
wow,
that was cool. To like
very cool
have that happen and just be like, oh, so that's what happens when that happens. And what do you do? What do you do? Like, you know, so we just watched it and she was fine. And the other one I was telling her about was when we did an elephant immobilization for a tusk extraction. We went to Birmingham, Alabama, They had a 10,000-pound bull that had like chronic tusk infectious. 10,000 pounds.
That's wild. That is insane.
10,000 pounds is crazy.
Yeah, and so the equipment for that, like when I got to the zoo, and there's a story around this that I'm going to tell you that's unrelated to vet med, but it's just like, of course this happens. But so we get there, there's like 5 other technicians from other zoos around the country, including a BTS ECC from the Elephant Sanctuary in Tennessee. They're like the biggest one in the country. It's like 20,000 acres. So all she sees are elephants. So she came down to like help. And when we then a bunch of vets and like these people from Africa, like University of Pretoria, which are like the elephant university of the world sort of thing. Came down to help us immobilize him. And when we got there for the run-through day, I saw pallets and pallets of fluids, just pallets of 5-liter bags. There must have been like 300 of them.
For one
elephant. Yeah, it was, and that's like, that was half the battle, was getting that stuff to the barn. But then like, you know, you have to get your ET tube, which is 6 feet long and it's like a 54 diameter. So it's like a big tube that usually like a girl has to pass through because their dental arcade is so small. So it'll be some random like vet student that has the smallest hands that gets to do this. Yeah. So it's like
gets to climb it in there.
Oh my God.
Their dental arcade like goes in like this. So it creates this little narrow space.
Oh, interesting.
Yeah. And then they only have 4 molars, and then their incisors are their tusks.
Are their tusks.
Yeah.
Okay. Interesting.
And so his were infected, and he had gone through like empirical treatments, and now they were like, we got to finally just get these out. And so to immobilize him, they trained him for several months prior, because it's something you don't just do like in a week, to accept ropes around different parts of his body. So as he went down, it wasn't to restrain him, it was to guide his body into the right direction.
For sure.
So we darted him with a CO2 pistol, and it was a Zaparone, a Torphine, and I think it was ketamine. Like there was another one in there, metatonidine maybe. That got him lateral, which was beautiful. I was like, so far, this is crazy how this elephant just laid down exactly on the right side that we wanted. Like it was, and then the task for the technicians came in where we had to set it 10 IV catheters to keep his fluid rate.
10?
Yeah, so we had 2 to 3 in each leg. They were 10 to 12 gauges. And then we had an abdominal. They're huge. And we had to do like...
So do you have to do a cut down? Because you can't...
Yeah, you have to cut down. Yeah. So a vet was on each tech team. There was 2 techs and a vet. And the vet would cut down.
Wow.
And the techs would do it because...
10 catheters.
10. If we could get more, we would have gotten more.
Yeah.
But then in his ear, the lead technician from Birmingham, she set like 3 art lines in his ear. So we could get blood gases and all that, because, you know, it's the same thing. They're monogastric. They're basically horses. And so, no, cows.
They must be ruminant.
They're cows. Yeah, they're ruminant. Yeah, because they have a big dry bolus. And so we had all those art lines in, and we intubated him. We had him on a ventilator that's it's called a zubinator, but it's a large animal. A guy named Jeff.
How is it big enough to ventilate?
So it's like a long. You can look it up. It's
okay.
It's really cool because we would use them for like rhinos, okapi, like big stuff. And it's a bi-directional. It looks like a leaf blower, and it's hooked up to these 2,000-pound oxygen tanks that have a special regulator on it. And it inflates up to 2,000 pounds of pressure at a time.
My goodness.
So you press it and you watch their belly rise, and when it reaches peak, you hold it for 2 seconds, then you let it down, and then you do it. And then you can breathe out without having to disconnect the hose. So that's how you ventilate them. You just can't use gas. So like 2 hours into the procedure,
their blood pressure is so low.
When there's no machine that can like deliver
or
at least it's there might be like 1 or 2 out there, but for field stuff we're using injectable. And so they're like doing the dental thing. They have these like 5-foot long elevators that are like, the blades are like a foot long, and there's like a diamond burr that's got to core out the thing, and then they break the ligaments around the pieces and take the tusk out in like quadrants, and then a giant clot forms, like a 30-liter clot, like a huge clot forms that plugs it basically. So when he stood up, this clot fell out and like went
Gushed.
everywhere. And the tech that was helping with the pass the instruments, within a minute of helping, she was covered in blood. And she was like, this is the best day ever. Like she was so excited.
So much fun.
And then you look over at Eileen,
Love it.
the tech from Elephant Sanctuary, and she's got like 15 5-liter bags strung up on these winches up into the ceiling. It was like an orchestra. It looked like a grapes.
Is she on a ladder? Just like
no, they were raising and lowering the chains.
Or raising and lowering unchains. Okay. Oh my God.
And so she's like keeping a 35-liter an hour rate going.
That's insane.
Wow.
35 liters
and so she's like
hour.
calculating it with her ECC brain. She's like, oh, we got to change these without like checking all the catheters for flow. Like it was insane. And then when
that was crazy,
like 2 hours in, you just start to see the trunk like do this a little bit. And so we're like, okay, let's get some ketamine. So you get a little bit of ketamine and then start an atorphine CRI, which is scary because that could kill you.
That is scary.
So the only indicator he's getting light is a slight
just
twitch.
a slight like little like reflex.
Yeah.
Because you go up and pick it up.
Goodness.
And
That's pretty cute.
And my job was to walk around and collect vitals and alert them to
Okay.
vitals. So we did have like a 1st-degree block, but I think it was because he was on his side. But we had like a monitor for heart rate, a monitor for SpO2, and then for temperature, you just had to get a regular dog and cat one and just put your arm as far up inside as you could. And it was like I thought I went like this. It was like a cavern. I was like, is there tissue in here? Like it was.
Where do I put this thing?
Their rectum is just so big. Like they just have such a big rectum. Like,
am I doing anything?
Yeah, I was like, I guess I'm just gonna. It's just in there. And so then like when it was over, we like woke up, started to reverse him, and it was like I wanted to cry because it was like everyone was. The big risk is if they can get up because they have to use their head to like throw their weight and then kind of get up that way. And everyone was like, come on, you can do it. Like everyone was cheering and like encouraging him to get up, screaming his name. And then when he finally got up, the keepers were bawling. They're like,
oh my God.
And then we all went out for drinks afterwards. And it was like the best bonding.
That was like the most massive undertaking.
Oh,
seriously, 35 liters an hour and monitoring. Because you can't just do an EKG, can you?
Well, we did, but it was we had to use like big needles and do the like into the skin.
Needle.
And even then, it was like not a great reading. So like it was like we think we got stuff, but it was definitely one of those things you'll. Like even 10 years after it's over, you still will probably want to talk about it and just be like, that was the coolest day ever. And like getting all the techs united and like we took like a group picture with the guy from Africa and like it was.
How many people total were there then?
I'd say
that is a big.
Including keepers, probably like 40 people were there. And everyone had a job and no one was higher than anyone else. We knew who like the head vet that was in charge was, but like, the teams, the IV catheter teams, it was like, we need the vet to do the cut down, but they were like, that's the tech role. Like, and it was like, it was just really showed what those relationships can look like. And
it worked well.
The day before I was going through the whole thing nervous though, because the day before when I had gotten there, I was like, I'm going to get here early so I can go out, check out Birmingham. And I was like, I'm going to go like the gay bar, like I'm going to go dance. Like I'm going to see what Birmingham has to offer. I get out of my lift in like an area where they're like, okay, don't leave this spot. Like, the lift driver was like, you're staying at this hotel, stay in this part of the downtown at night. Like he scared me. And so when I got out of my lift, I shut the door and was like, let's do it. And I felt and my phone was in the lift and he was already driving halfway down the street.
No.
And
that is the worst feeling in the whole world.
It's like, I don't even know anyone here to be like, let me walk to the zoo. Or like, I was like, what do I do? So I started going into, I was like, well, if I'm already down here, I might as well just do my original plan. So I went into like different places and I was like, do you have a phone I can use? And they're like, like, do you mean my phone? And I was like, no, like, does your business have a phone? I left my phone on the lift. And they're like, no, we don't really have that. And I was like, what? So I just kept trying different places, and I finally made it to this one place, and this girl was sitting at the bar all wasted, and I was just sitting there looking dejected, like, what am I doing? And she was like, what are you doing here? Like, she was just like trying to make conversation, and I was like, I left my phone like in the lift. I'm trying to like, and she's like, oh, do you want to borrow mine? Like, you can use my phone. Like, she was like, and I was like, that's weird. Like, but I guess so. I tried, and my phone was I put my phone into her phone.
Locate it, like the locator on hers to find. Okay.
And so from there, I was able to message the Lyft guy, and he was like 30 minutes outside of town. So I knew I wasn't getting that phone back until the next day. And so I just finished the night, and it was great, but like, it was so scary because I was like, I'm supposed to be at this elephant thing, and I'm
like, you have a very important role.
Yeah, and I'm like,
project ever.
I don't know where I'm at. Like, how do I should I just move in should I just pick this as my home? I don't know. I live in Birmingham now. I'm never gonna get out. But so that went really well, and then it was just really cool seeing that. And I feel like people though like look at that type of stuff and go, I could never do that. It's like, well, no, it's just a bigger thing than what you already I mean, there's details you need to like learn, but overall, like transitioning from Dog and Cat Anesthesia to Zoom Ed was probably one of the easier things I've done. Just because when you learn how to work with, like, when you learn how to learn about those animals, you learn them in taxon groups. So you'll have something like the group Xenarthra. So when someone's studying for that species, it's like canid versus feline. You look at everything in the group Xenarthra, which is sloths, anteaters, armadillos.
I love sloths.
Oh,
like I have never. I'm so sorry to divert, but I am one of those people. Like, I would cry if I would physically cry, and I've never met one in person.
Oh, you should.
Only seen them from afar. Like, if a sloth hugged me on my arm, or if I got to hug it, I'm like tearing up thinking about this.
Yeah,
I'm not joking. Like, I love them.
Okay, we need to coordinate this. Okay, there is one.
Can you find one?
There is one outside of Las Vegas.
Okay,
sanctuary.
Cheyenne Mountain Zoo might have one too.
Oh yeah,
Cheyenne Mountain. Oh
yeah. I think some of those places have sloth like experiences too. Not where you can like touch them, but like where they'll be close enough to be like.
She has to hold it.
Yeah.
But then you have to remember that they have
they're covered
canines. Like, their teeth are dagger sharp because they're opening like nuts and stuff. But that's also their line of defense because they can't do anything else. So like,
puncture you. Yeah.
And so cool. When we would hand inject them, they got really fast, and you were like, wow, sloths are actually kind of fast because
they could be fast.
They can move.
Like with their head and that kind of thing.
Yeah.
Okay.
So when you're like thinking about the animals that are related to sloths, most people think like monkeys, things like that, but they're actually more related to anteaters and armadillos. And when you break down Xenarthra, Xen means strange, and arthra is joint, so strange joints. And if you look at all three of those species, they have extra articulations in their cervical spine that let them reach further or use their front arms. So like a sloth, you think.
Interesting.
And when I'm like rambling, so if you want to like me to stop or anything.
This is great. No, this is great.
Cool.
But they so what they'll do is their metabolism is so slow that they have very small stored energy. And so like their temperature is like 92 usually. Like, that's their normal body temperature. And they poop once a week. Like, it's like crazy. But when they're like, I want to move, they want to expend the least amount of energy moving as possible. So when they reach, they want to make sure they can reach as far as they can to get somewhere in the least amount of movements. And so that's where the extra cervical vertebrae come in to help them extend. And then when you think about like an anteater, they're digging in the dirt, ripping apart. So they need to have strong forearms to like, so they've got those extra articulations too. And so we don't learn about them as individuals. We learn about Xenarthra. And then you may never see an anteater, but if you happen to one day, you at least know some basic things to help you do an exam.
Interesting. Oh, I love that.
That's
crazy.
Really
cool.
Yeah.
Was there like any animals that you, I guess, bonded with? in working with them? Like, is it hard to leave the zoo? Because I feel like they're around. It's not like a typical patient that comes, you help, they leave, right? You're in their environment all the time.
Yeah,
So did you have
it's very easy to make them not your pets, but think about them as a family member, or like the zookeepers especially, because they're spending more time with those animals than they are their own families and their own pets at home. And worrying about them when they leave the zoo, they're thinking about locks all night. They're like, did I lock that lock? So it's and the same thing with vet people. Like we leave and we go, oh my God, like did I send that down that dewormer? Or that an animal is susceptible to something, and so you're worrying about them, and like what are you going to walk into in the morning? And so when I left the zoo full time, like it was really hard to separate. Like I felt like I didn't have a right anymore to care. Like, it's kind of like, well, I'm not working with them directly, so I can't, it was a feeling of like, should I claim them as my patients still? And someone told me like, they'll always be your patients. Like you don't like, so whenever I see something about an animal I've worked with at another zoo, it's so I always feel like, oh, like that's my
you still care.
my baby.
Like that's so sweet, Mark.
Like
I love that.
the baby orangutan from Phoenix Zoo when I was there, he is 8 or 9 now, and he's like starting to flange out, and he moved to Zoo Miami to like get a girlfriend. So when you see the male, he's with his little girlfriend, and they look like the weirdest little couple, like old man, old woman, young couple. But so I look at that and I go, oh, like I had a part in his journey life there, and like it just makes me feel like, okay, well maybe I can't, talk about them as if I still
my gosh,
well, it's such a collective effort in zoo med. Like there's you need a lot of people and hands on deck, so I think you're always part of it.
Yeah, and that's what I've kind of gotten to where now it's like less about like, now I just post in like with like a heart, or like I'll like like it's not like their mind, so but it's like, oh, like the grizzly bear girls I used to work with at Henry Vilas just moved to the Lincoln Park Zoo, and I saw pictures of them like doing in their new habitat, and I was like, oh, they're gonna love it there. Like it's so nice. And so you get to follow their journey and then hope people fill you in, when stuff happens.
Did you ever have like situations? Sorry, I'm like super interested.
No, keep going, keep going.
To you all day about this, but like, did you ever have situations where you were like afraid, like in danger from working with like fractious stuff too? Like that's a huge undertaking.
I think I was most afraid when it was something that we couldn't control. So like when you're waking a rhino up from anesthesia, they are stumbling around, hitting whatever they're hitting, like, and you just have to stand back and remember it's a rhino. It's a tank, like it's supposed to hit stuff, like. So it's hard to do stuff. And one time I had a hyena that was having a seizure, and you can't just go in and establish IV access.
That's
so
what I mean.
it's a lot of like watching and just but we've got to the point now where like if we see an animal seizuring, we can dart midazolam, or we have interventions, and it really depends on the skill and comfortability level of who's at that zoo. But the thing with zoo that I was like, when I saw tiger immobilization on the schedule, I was like, awesome. When I saw, like pelican wing amputation, I was like, cool. If I saw a snake on that board, like the schedule, I was like, it better be asleep and someone else better catch it up, because I can't read them. Like I can read them when they're asleep. They don't have facial expressions. They're not going to tell you. They're going to go from this to like in your face. And
see, I agree with you. Yeah. So that's not my jam.
We would do like, I remember like I've intubated king cobras and anacondas, but they've always been under chemical restraint, which was what I needed. But there have been times where like at Oklahoma, we had these black rat snakes, and they would get into our outdoor aviaries and eat the wooden dummy eggs. Because the keepers would pull the real eggs, incubate them, and then put dummy eggs for the birds to go through their cycle. And the snakes couldn't tell the difference. They would go in there and eat the wooden dummy eggs, and they'd get stuffed.
And then you'd have to extract them.
You'd have to milk them up. And I have a video I can send you guys. It's like, you just see this egg just come out.
Amazing.
That is crazy.
It's insane. But for me, like, sometimes I'd be there on a Saturday by myself, and the vet would just be on call, and they'd be like, Mark, oh, just
gotta do
it. And one time they brought up this little snake. It was probably like this long, like half a foot, 6 inches. And I was like, my 2 tongs, like I was not like on full view of the public, because they're all like, we had public viewing windows, they're like watching, and I'm like treating this little tiny thing non-venomous, and I'm just like, we gotta like, I was like, I can't, like, they bite,
yeah,
and I don't, it's crazy.
I don't want to get bit. Fair enough.
Any sort of teeth. And so like
bite.
I can and then like I'm getting better at it now to where I can catch them up a little easier, because I had one vet that was like, Mark, just be a tree. That's all they want you to be, is a tree. Don't just sit there crawling around, just be a tree. And they're not trying to get you, they're just trying to find the spot to be stable.
Oh, okay.
And so
interesting.
Now I approach that where it's like, just be a tree, just let them crawl. And
that's good advice. That is so funny that you feel that way, because then you went to New York and your first job was avian reptile, wasn't it?
Like, I worked at a big place.
Like, let me go to the snake place.
It was like, wow. But switching to that from zoo to exotic companion animal is not a linear switch. Like the stuff that we did in zoo was not what they were always comfortable with, because it was people's pets. And so there was like that fear of like, what, and so that was something where I was like, well, if you explain anything right, or in the right context, and so I didn't really gel too well with like private practice exotics people versus zoo. Like, I feel like I got a lot of like judging that it was like a rodeo in the zoo all the time, and like, oh, we didn't do things sterile. And I was like, no, we do probably more than what I've seen coming back. Like, we're doing sterile scrubs and that kind of thing. And so it was just like, I didn't want to have to convince people of my knowledge. So
you don't need to prove yourself.
Right. Exactly.
So that's why I've been trying to find the right place since then. I think I'm surgery and all that's right. I love surgery, because then I went to cardio. I worked in cardio for like 9 months and did pacemakers and PDAs, and
that's crazy.
Which that anesthesia is insane, because like when you have a PDA and you occlude it, you're changing the ventricular pressure, and so like their heart rate drops to like 10, and they have a reflex hypertension, but that's just because you plugged up a hole. And so it's just seeing that stuff like makes my nerd brain go like, what's now? Like, what happens next? Like, I see it as like a story, and like, this should happen if this happens, and that should happen if that happens. And I think that mindset, that surgery, anesthesia, cause and effect mindset, has made it difficult for me to go back to any sort of regular medicine, because we've seen these things work. Like, I've seen lungs expanding in front of me. So when you go, don't go above 20, I'm like, okay, well, who are you talking to here? Like the kid that just graduated school, or the person that's seen what 40 looks like on lungs? Like, lungs can take.
They can take 40.
Especially if they're atelectic. And so I feel like my long-term place is somewhere where someone, like a special. I don't think I could ever like
a specialty. No, I think you have to do specialty. You know too much.
You know so much.
And you're too intelligent for like
so smart,
like the average day-to-day stuff.
But like, seriously, something I've never done is like, I've never done a horse surgery. Like, I've like that stuff. Like,
you probably love it.
Like winches and upside down and from the feet, and like all this stuff. Like, that stuff is so cool to me. And how you close those abdomens back up with that big, huge. Like, we did a necropsy on a white rhino, and that cecum was like, you could put 5 people inside of it. And I was like, if this was a horse, it's probably pretty big still. How do you just all push it down, and then like?
There's a belt. No, there's actually tools for it. So there's a, God, I'm forgetting it, a belly pad. I'm going to butcher the name. We'll figure it out and put it in the comments. But, it's surgeon dependent. For the most part, you can just kind of like shake them back together.
Yeah. Oh, that's so
enough of your linea that you're going fast. But there are surgeons that like to put this belly like kind of plastic sheeting in, so that you don't take any loops of like serosa or anything in there, because it just like bubbles up.
It's crazy. But that reminds me
Yeah.
of I think it was Columbus Zoo a couple of years ago had a pregnant giraffe they had to do a C-section on,
Oh,
and it had never been
Whoa.
done, never documented, so it was one of those Hail
Oh,
Mary
Oh,
sort of
really?
things.
Oh, wow.
And the
but you
baby
just
was
got to
born
do
with
it.
like
Yeah, I
Yeah.
mean,
they just had they have 2 baby elephants there now too. But they that giraffe was born, it was like stillborn, it was all genetically deformed. Like it
Okay.
had like 2 heads. It was
Okay.
not coming out.
Okay. Yeah.
But then
Yeah.
so they were like, okay, so in order to save the mom, let's do this last ditch
Yeah.
effort. Because of the weight of their abdomen, it
Yeah.
dehisced like within 24 hours. But they had to use like steel cerclage wire for those because
Oh,
they're
I
like,
bet.
I mean, giraffe are thousands, like they're like
They're
2
so
or
big.
3,000 pounds on their own,
Yes.
and they're high,
Yes.
so it's not like
They're
you
very
can
high,
keep
yes.
them in stern like lat, like you
Can't.
can't like keep
No,
them
you can't.
down. They have to be up,
No.
and
Wow.
Oh,
so it's like that stuff is rewarding, but it's also sad
Yeah.
because now we know that information, but
yeah.
and so that's
Well, and in a horse setting, because there are horses for sure that develop hernias and then can dehiss if they get out because they're not very good at sitting still.
yeah.
And we have belly bands, but I don't think you can do that in a giraffe.
No, they're gonna try
it
to
would
kick
be
it off, or
no,
it's.
you would not leave it on.
But
Like,
so, is it a circumferential band that you
Mhm.
like?
yep, you can either make one with Elasticon or they actually sell some really nice belly bands. So I wonder if, like, the denier of the fabric. I don't even know if you
Yeah.
could get a custom made one.
Yeah, like
Yeah.
canvas
like-
even or something.
Yeah,
like less.
something.
But
Yeah.
that's like, but everything is learned on horses and stuff. Like
Yeah.
for residents coming into zoo, they want them to have like a large animal internship or
Okay.
something. And so,
Okay.
because everything you're doing is
Yeah.
based on that. And if you're comfortable around those big animals, you can be
Yeah.
comfortable around the others.
Well, and I also feel like it's so similar because we've talked about this with a couple other guests too, that it's a lot of it's MacGyvering stuff. Like
Yeah,
you
it
show
is.
up at large animal
Yeah.
calls and farms and stuff happens and it's like, how do I fix this? Like
Just
it's
use
not,
what you have.
you know,
yeah.
you use what you have.
Yeah.
Yeah. And
Oh
so
my
I feel like
gosh.
zoo is probably so similar.
Oh
Like, it's
yeah,
just-
we are making stuff. We had the AI and elephant, and it was crazy. We had to collect sperm
arm
and then
leg.
like run it over to the female within like minutes, and we
Yeah.
collected it in these conical tubes that we had warmed up, and we kept them in an incubator, and then they rectally stimulate the male to drop, and then
Okay.
Uh-huh.
Yeah.
they're
Yeah.
doing that for however long, and we're down there with these conical tubes on these like poles like a net, and we're like all waiting to catch it, and if he pees it's ruined, so we want to catch like
right.
but so like we run it over to the female, and we've taken like a 18 millimeter trach tube and turned it into
Yeah.
like
an
a
AI tube.
stylet. Yeah. So
Mhm.
we would put that through to the ovaries, and you could literally see drip the semen exactly where you wanted it. And
Wow.
having to like make all that stuff, like
Yeah.
they made an igloo cooler into an incubator with like a heating element in it and everything, and like
That's cool.
when we're trying to train like and make different types of squeeze chutes, it's all about figuring out how is this animal going to work with this
Yeah.
device. And so that's where, whenever I had an idea, I would call somewhere like Vet Quarter or Mila, and we'd say, hey, we need this very special tube, are you interested?
Yeah.
And usually people are like, yeah, let's make the thing
Yeah.
for the rhino. And like
Yeah.
Seriously.
it was like we
goodness.
took pono blocks, and they made us a special one for a giraffe so we could get awake hoof x-rays, and he can step
Awesome.
on it with his whole weight.
Oh.
And
And not crush it.
yeah,
Yeah.
because in Colorado there's a program called the Zoo Hoofstock Trim Program.
Okay.
Steve Fox runs it, but he basically is an farrier expert in exotic hoofstock.
Oh,
So he travels to zoos and trains their people how to do voluntary hoof trims, as well as sedated on things like okapi, rhinos,
wow.
anything with hooves. He'll because it's not the same. Like you'll see a lot of horse farriers be like, oh, I can go train in zoo, and they just walk differently. They have different, they're putting their weight on different things, and so you wouldn't trim a giraffe the same way you would a cow,
horse.
even though they both have two claws.
Yeah.
And so that's been cool to like see that evolve, and like it's just I wish there were more shows that were like behind the scenes.
Yeah.
For sure.
But for
That
every
would be
good zoo,
That would be
there's
cool.
like zoos where there's only a vet once a week, and
Right.
Yeah.
you get in there and you're like, wow, this looks good on paper, but some of these animals haven't been vaccinated in decades, and they were just
wild,
lucky.
And they're independent as far as just like decision making for what am I looking for
like accreditation,
standards of care,
standard of care and all of that. Each zoo is independent on their own
for the most part. There's and this is one of the reasons why like I started to have some like differing viewpoints of what I believe to be real oversight, is that a lot of the accrediting bodies make guidelines, and they say, here's the end result, but we're not going to tell you how to do it or like what. So they're like, as long as that in the end, this is what happens, we don't really care how it happens. Not to say they don't care, but that's it's like, we're not going to tell them what to do. How to do it. We're going to tell them what needs to happen. And to me, that meant like first thing off, like the Association of Zoo Vets created a guideline for medical care of any exotic wildlife animal facility, regardless of whether it's an AZA zoo or whatever the accrediting body is. They made these veterinarian recommended standards of care. And then AZA took that and said, well, we're going to adopt those as our standards. And so the standards that were written were not written for the accrediting body specifically. And so it'll say a vet animals must receive checks at least once a month from a vet. It doesn't say that this accredited zoo needs a vet on staff 5 days a week. It just says they need to be available. And in my eyes, it was too broad. Like, it didn't put enough on the facilities. And so, you've got a facility like, let's say, San Diego Zoo, where they've got all the resources in the world. They could have 5 vets on staff. They could have a nutritionist. And then you go to a smaller zoo that's in like a tiny town. Yes, they're AZA accredited, but they don't have a nutritionist on staff. They're contracting out a nutritionist once a year. And so that's where things can fall through the gaps, and
wow.
And it just wasn't something where I was like, I feel like it's kind of putting this false, like, you tell the public, oh yeah, accredited zoos have all these things, and it's like, well, some accredited zoos and these ones have a version of it, but it's it's just not the same. And then one of the big things was enrichment. So you see these animals like they're stuck in these enclosures. They don't clock out at 5 and go home when the day's over. They're still in their enclosure. They're still in the same spot. So making sure they're mentally and physically engaged. I had a lot of problems sometimes because the standard didn't say specifics. So you would get maybe one zoo, they go, okay, it says we need to enrich them twice a day. So the first one of the day is going to be, we're going to hang some wrapping paper on the window and call that visual enrichment. And I'm thinking, for an orangutan, that's like if someone went to your house and hung up like a picture from a magazine and is expecting you to be engaged by that all day.
They're so intelligent that's boring.
So so that's where I started to differ, because I thought they should be stricter. If you're going to be accredited, it should be more oversight. But
well, that comes into social licensing, which is, I mean, look at the SeaWorlds and the the marine stuff too, with enclosure size and enrichment.
It's just, and like, no matter how,
it's not going to continue if they're not careful.
Right. And SeaWorld's already like, they can't breed again. But I know some techs that work at SeaWorld, and they do care about the animals. Like, I don't
do.
Is it the best situation?
People working. The people working do, but you wonder about like the corporate structure and the higher up,
which definitely
it's a profit-making machine,
just like in vet med, we've got those practices where it's like, we're going to charge the client XYZ. Doesn't matter what their financial situation is. I worked at one practice after I left zoo that would go through the treatment sheets. They had a huge billing department. They would go through treatment sheets and records, and if something was notated in the record but it wasn't invoiced, they would back bill the client. And I was like, how?
You forgot that. That's on you.
Yeah, seriously.
Like, how? I just don't understand how you can get anyone to come back to your clinic after that. I would be
Yeah.
like,
Right.
you mean
Right.
you didn't catch that in the beginning? Like, how's this
Yeah.
Right.
my fault
I'm not
now?
going to pay for it now.
Right.
Yeah.
And
Totally
so
on you. Yeah.
I
Yeah.
feel like kind of like where I'm just like, I just want to coast now for the rest of my, what I got, like 30 years
I,
left alive. Like, I just want to like
oh,
go
you've
in,
earned
do
it,
good
man.
medicine, live in New
Yeah.
York City. Like, it's
Yeah.
the coolest city in the world. Except that
Cool.
most stuff on the weekends doesn't start till like 11 o'clock and goes until like
Well,
you
yeah.
4
have
in the
to
And I
have
can't
morning.
even stay up till like
the young
midnight.
stamina to
Yeah.
go with
You
it
do have to
too.
have the young stamina.
I'm like in bed by 11.
Yeah.
Yeah,
Like,
it's
That's
like,
my latest.
but it always gives you that, like, if you get out of an overnight shift or like a late shift, like at 12 to
That's
12,
true.
you know, there's something
yeah,
to do, you know, something to
there's
walk
That would
around the
be
things
village
going
cool.
and
on.
Yeah.
Yeah, that's
I
yeah.
can see that
cool.
with a different time
Yeah.
schedule.
Oh man. Well,
Yeah,
Okay,
so
well, I need to extend the offer though, because there's
yeah.
plenty. There's actually like an anesthesia position coming up close to us at an equine hospital. And then my sister-in-law works at CSU. She's an equine surgeon, and we know all the anesthesia people. If you ever just want to come out for like a couple weeks locum or whatever,
yeah.
Yeah.
and
Oh,
like do horse stuff,
cool.
yes,
Oh my
like
gosh, that
That
would
would
be
be
so
awesome.
awesome. And I have like all my,
yeah,
yeah, that'd be great.
yeah.
That would be
Okay.
so
bother
So
you
cool.
about
and,
it.
and we could take you out in the trucks for a day, you know, and just do
I
some
Come
love
with you.
field work.
castrations
Like,
and
oh my gosh,
yeah.
like field work. Like, I would pack up a golf cart with like jam pack it and like go around on like the zoo with my little hospital and my golf cart. And
I love the golf cart.
it was
That's
just
awesome.
like nothing
Yeah.
was meant to be taken into the field though. So it was like,
Well, yeah,
you gotta like
yeah.
lug
Yeah.
all,
That's a
which I'm sure,
problem.
yeah,
I
but
love
like,
it.
it was like,
Oh,
I
we
always
should do
had
that.
those giant horse drapes, like the huge ones.
Mm,
I always
yeah.
had those in stock, and I was like, I'm never gonna need this, but I'm gonna make sure that it is here. So
But
when we need to
you
do that
bet.
one thing,
Yeah.
like,
Yeah.
Yeah.
You never
bet.
know when you
Yeah.
need drapes.
no, that would be so
Yeah.
awesome.
You should. Yeah.
I feel like I already like took up
Totally.
so much time. Did we even
Well,
talk about
your lunch,
anything?
you
No,
took up,
I feel like
we're
we could do
taking
a
up
part
your lunch
two.
break.
Yeah, we're taking you probably haven't even eaten yet.
I know,
so
but the
maybe
whole time it's just like you guys like nodding,
do
and
it
I'm like,
because
do you
it's so
guys need to, like, you
fun.
say
It's
anything? Okay,
amazing.
Yeah.
as long as you think the content.
Oh, it's amazing. And
No,
I
you're
have
the
like
best.
18 questions, but
I know, me
we'll have
too.
to do a part 2 at some point.
Yeah,
Yeah.
we can totally do one like
Yeah.
it's more
You're so fun.
specific, but like I could, like I said,
Okay.
I could just ramble on and on and on, and it's like, I will say to your listeners, support your local zoo. They
Yeah.
and if you
Yeah.
do have feedback, tell them in a polite, you can write zoos an email and say, hey, your exhibit, why does it look the way it does? And they'll happily explain to you. Zoos are very much getting away from the keep everything behind the scenes. When you see zoos building hospitals now, they have public viewing because
Yeah.
they
Sure.
want people to see,
They're taking care
Yeah,
of the
Denver
animals.
Zoo
and if
does.
you
They
have
have a
nothing to
very
Denver's-
hide,
Yeah.
that's
great.
them.
Yeah.
Although it used to be in the past, the animal rights people they would hide stuff because they don't want misconstrued
yes.
context. But now
Yeah.
it's
Right.
like, well, by not showing it, you're letting them create their own narrative about what is happening. And if you are honest, deaths happen
Yeah.
everywhere.
That's
just
wonderful.
so still support your local zoos, but just like roadside zoos, they need to have some sort of accreditation. And if anywhere lets you take pictures by holding, I know you want to hold a sloth, but
I know.
those are the places to be a little more wary of. Now, if the
You're
sloth is
dashing
hanging
pictures
from like
of
a tree and you're standing next to it,
Okay.
that's cute.
Okay.
Yeah, but
That's close enough.
Okay. I don't.
I'll try
okay.
I'll try
I
to
need-
ask my zoo people who I can get you
Okay.
in with to like get closer
Okay.
to one though, because it is really
Deal.
cute to feed them. They eat
Get
real
close.
slow. They
Yes.
grab it real tiny. Yes.
Yes. Yeah, I would be so cool with that. That would be great. A little feeding action. That'd be amazing.
Yeah. So just keep doing
Cool.
all the awesome
Cool.
stuff you're doing too. And when you
you.
start making those big, huge Vet CS zoo
Yeah.
stuff,
You're our guy.
Yeah.
let me
You're
know.
our guy.
I'll give you
Totally.
some people. But
Heck
Okay.
yeah.
Okay. Thank you,
Thanks,
Mark.
Mike.
yeah, you too. Thank you so much.
Thanks for listening, everybody. We would really love to have you as a guest on our podcast. So if you have any fun stories to share with us or would like to be a guest, we have a form on our website. So unhingedandOnCall.com. And you just click on the little link there and you can fill out a little bit about your story and yourself, and then we would get back to you. Or you can just email us to chat@unhingedandOnCall.com and just tell us a little bit about yourself. And we would love to have you as a guest. We also are looking for ratings. So essentially on Apple, Spotify, wherever you get your podcasts, you can rate and review our show. And that would be super helpful in just getting kind of into the algorithm. And then additionally, we are on YouTube. So if you ever want to watch videos, we put more content, like visual content, so pictures, videos, things like that, into the episodes. So we'd love to have you follow or subscribe our channels on YouTube.
Yeah.
Thanks for listening. Thank you.
Thank you for tuning in. Make sure you subscribe and follow us for all the latest updates. Unhinged and On Call isn't just a podcast. It's a lifeline for every veterinary professional barely holding it together with vet wrap and caffeine. Somewhere out there, another tech, vet, or assistant is deep in the same chaos, dodging poop, managing meltdowns, and wondering if they're the only one unraveling. You're not. Whether you're laughing or crying or rage cleaning your truck, you've got a whole tribe behind you. You're unhinged, but never alone.